Just this past month, CBS This Morning anchor and North Carolina native Charlie Rose underwent aortic valve replacement. Now, the procedure marked the journalist's third valve surgery and second on his aortic valve. Dr. Kevin Campbell is here to talk to us about heart valve replacement. So exactly what happens and what causes to need a valve to be replaced?
Well, first of all, we've got to understand that valves are structures that are located between the chambers in our heart, and they allow blood to flow in and out of the chamber during the appropriate time during the cardiac cycle. The most common heart valves that need replacement are the mitral valve and aortic valves. And these need to be replaced when they become stenotic, which means they're narrowed and stiff, or when they leak badly, which we call regurgitation. Some common reasons why heart valves become narrow and stiff or leaky really include infections such as rheumatic fever that some people get as children, or staph infections, as well as just general aging. Other causes may include congenital heart disease as well as just a weakened heart muscle.
So there's symptoms that patients might have that will allow them to know they might need a valve replaced?
Exactly. You know, some of the things that we see are shortness of breath. We also see, some chest pain. We could see fainting. You may see swelling in your ankles. But, you know, these are things that should really prompt you to see your doctor and talk about, do I have a valve problem?
I mean, these are the things we typically see anytime you might have some sort of heart issue, right?
Exactly. Very, very common. But if your doctor listens to your chest with a stethoscope and then, gets a sound wave test called an echocardiogram, we can really make that diagnosis pretty darn quickly.
Pretty quickly. All right. So talk to me a little bit about Charlie Rose and his condition.
You know, from what we know, Charlie Rose has had previous aortic valve replacement about 15 years ago at Cornell Medical Center in New York. In 2006, he was in Syria and had an emergency mitral valve replacement in Paris. He was airlifted to Paris. And then this past month, he electively had an aortic valve replacement that was done on his same aortic valve that was done 15 years ago.
How would you know that you need to have that replaced?
So once you have a patient that has an aortic valve problem, we measure that valve with an echocardiogram or an ultrasound every single year. We also ask particular questions about symptoms. And, so the most important thing is, looking at that objective data from the echo and then talking to the patient about symptoms and listening to their chest.
And that's when you figure out the options, right?
Exactly, exactly.
What sort of options are there?
Right now there's a lot of different options for replacing a valve. One of the things that is most common is having to have a big incision down the middle of the chest, and that's open heart surgery, and that appears to be what Charlie Rose had. There's also newer techniques that are being developed locally where we do catheter-based transaortic valve replacement, which is a new one. And then also we can have minimally invasive valves. And it really depends on what the structure of your valve is, what's going on, why it failed, and the skill of your surgeon.
All right. It's a lot of things that can really only be answered by your doctor. If you're having these symptoms, please see them.
Absolutely.
Don't waste time. All right,
exactly.
Dr. Kevin Campbell, thanks so much for being